A good morning, everyone, and welcome to a special edition of Daytime Columbus featuring Licking Memorial Health Systems. I'm Robin Haynes.
Good morning, and I'm Rob Montagnes, President and CEO of Licking Memorial Health Systems. We're happy to be celebrating Heart Health Month coming up in February. We want to share some of the highlights, upgrades, technology adoption at Licking Memorial Health Systems.
So from advice for keeping a healthy heart to cautionary stories to keep in mind when it comes to your own life, we are helping raise awareness on today's Daytime Columbus. All right, thanks as always for joining us today. Rob is going to share some of the exciting things we have on tap today.
And we're going to kick things off with an outstanding physician, Dr. Rajub, one of our interventional cardiologists, and he's going to talk about some of the different symptoms for men, women, looking at some of the recent updates I talked about, and show us really the incredible ways that we're saving lives every day in our cardiology facility there.
And we'll chat about a big donation by this community hospital that's changing the way local organizations tackle heart health on the front lines, plus a young student athlete taking advantage of a free program offered by the hospital. And she has some advice for anyone in her situation.
And we'll always want to finish up with our 5 facts that will make you appreciate all the things that our outstanding employees do at Licking Memorial Health Systems, especially in the cardiology area, saving lives and saving hearts.
All right, Daytime Columbus starts right now. Licking Memorial Hospital has served the needs of Licking County since 1898. They are a community hospital dedicated to improving the health of their members. And as, like Rob mentioned, we get ready to celebrate Heart Health Month, it is a great time to showcase all the tools that they have at their disposal to do just that.
Well, our team of cardiology nurses, physicians, it's really home to an outstanding caring group of individuals. They are truly, to use a pun here, the heart of our hospital. So we're proud of all the work that they do.
And Rob, I wanted to, before we get to kind of looking at all the great things that you have done there, I want to ask you, we mentioned your community hospital. What kind of misconceptions would you think people relate to that? Because we're going to learn, obviously about all these updates and upgrades you've made. What do you think some people think when they hear that?
I think a common misconception is that maybe community hospitals can't take care of very advanced illnesses or clinical issues. And many community hospitals, and I can speak mostly for Licking, we're able to provide very high-level care for advanced types of clinical issues. I think the other common misconception is the technology availability at community hospitals may not rival that of larger facilities. And I can tell you, obviously, at Licking, we've been named a most wired hospital for many years, and the technology we have available in Licking County at Licking Memorial would rival that of any of the larger facilities. So oftentimes, folks don't need to travel long distances to get high-quality, outstanding care. Certainly, we work well with all the tertiary centers throughout the Central Ohio area, but we're able to provide that outstanding care right there in Newark, close to home.
All right, Rob, with all that in mind, we did spend some time, as he mentioned, with one of their top cardiologists. So he's going to share some more about their recent improvements.
Dr. Rajub, thank you for joining us. We're going to talk about cardiology services. It's one of our biggest service lines in the hospital, and for all the hundreds of thousands of patients that come here, cardiology is something that they need quite often. So, Dr. Rajub, explain some of the common services you provide and what folks can expect when they come in the cardiology area.
We provide pretty much everything in cardiology, starting with cardiac catheterization, putting stents, balloon angioplasty, placing devices like ICDs, pacemakers. We have a congestive heart failure clinic too, where we take care of patients with heart failure. We have cardiac rehab in the same setting too. We take care of arrhythmias with atrial fibrillation. It's everything covered in cardiology, basically, including obviously prevention of disease.
It seems cardiovascular disease is becoming a bit more common, or is that just because the awareness is out there?
The cardiovascular disease is responsible for 800,000 deaths in the United States each year.
Wow.
So 1 out of 3, they die from cardiovascular disease. So that's why it's very prevalent. It's the #1 cause for death in men and women.
And you did mention, this is happening to any age, so everybody should be aware. Are there symptoms out there that people should look for when it comes to having an actual heart issue?
Yes. Age group wise, for men, we say average age 60 to 65, but remember, 10% occur under the age of 45. So at any age, really, if you have specific symptoms, chest pain, we call it tightness, heaviness. Most people wait for this sharp, severe pain. It's usually not the case. In women, they have different symptoms sometimes, a little bit more jaw pain, or just sometimes in older people, just being tired for no good reason. These could be signs of cardiovascular disease.
Maybe talk about some enhancements to the Heart Center, what we have available here, maybe that wasn't here a few years ago.
Well, we start with really the biggest area. Our clinic has been renovated completely.
Yes.
And at the same setting, we had renovated the rehab area,
Yes.
which is very important after you have any cardiac events. Cardiac rehab is very important. Happen in the same setting. So we were seeing rehab patient close to us. We keep a close eye on them. We actually even recently, even the monitor system,
Yes.
you can do it instead of sitting there on a monitor. You have an iPad where you follow the patient and see how is their heart doing and the rhythms or any problems. And then we have 2 cath lab actually. We just renovated our cath lab. It's really unbelievable.
A staff member wrote a letter kind of singing your praises because an ordinary Sunday afternoon, which many of us are sitting at home watching football or doing something
Yes.
about talking about the weekend, you're saving lives 2 at the same time pretty much. How does that make you feel when you hear, these accolades and these praises from people you work with?
It feels really good because that's what you spend all your life in medicine is a long journey, but it's very rewarding. The whole process for us with these cases on Sunday, the squad gets an EKG that's with the technology the hospital provided, get transmitted to us. I get it on my phone, I see the EKG. The staff will be here sometime before the patient. You're waiting for the patient
Yes.
to come in, which is really tremendous. And you take them to the cath lab, you open the artery, and it goes from there.
Well, it really makes me proud when we hear about how we're able to immerse our technology in the community, marry that with what we offer here, and then have great practitioners. I certainly want to call out some of the other practitioners here, Dr. Heldman, Dr. Tecleus, the nurse practitioners, Patty Merrick, Leslie Solomon, the rest of the staff do a tremendous job, and they really take that technology and turn it into saving lives in our community.
All right, absolutely. Dr. Rajoub, thank you so much for being with us today. Of course, all happening at the Licking Memorial Health System's Heart Center.
Well, it is clear that Licking Memorial Hospital is fully equipped to handle the heart cases that come through its doors. Up next, how it is also giving patients a stronger chance of survival even before they arrive at the hospital.
And later, a young swimmer takes advantage of a free hospital program and finds out some surprising news. What you need to know if you're a student and an athlete in Licking County.
Oh, when it comes to a medical crisis of the heart, time is precious. In fact, what happens before emergency crews arrive to help could mean the difference between life and death. And I'm going to be talking about this incredible donation made to the community. Life-saving measures can be started even if no medics are on hand. So today, Ed Warren with us. You are the CEO of Licking County Family YMCA. And of course, Rob, this really is an incredible donation that you guys made to them. So first, start by telling us what it was.
Well, I think it was important that we got AEDs, so these portable devices that can detect if a heart is not in rhythm, and then if it's not in rhythm, can help shock it back into rhythm until we're able to get the patient stabilized to the hospital and cared for by the outstanding practitioners you saw. And we wanted to make sure these were available throughout the community, so wherever you may be, you would be close by and someone could use one of these. We made them available to first responders. We made them available in the schools and then to other organizations like the YMCA, so that where folks are actively working out, maybe watching their kids play sports, wherever the case may be, one would be nearby.
And these are automatic defibrillators,
Right.
the AED, the short-term for it, obviously. So if you're giving them to all these organizations, we need to know, do these people have to be trained? Is this something that's a simple use as far as this actual unit is concerned?
They're very easy. I would still encourage folks, it's great if they go through some CPR training or certification. It's great to have those skills and knowledge. But the AEDs are so easy to use and they really walk you through step by step. So to have them available and really folks can step in and they're so useful, lives are being saved because of their availability.
All right, Ed, one of those devices, as we mentioned, at the Licking County Family YMCA. How long have you had this now then?
I was trying to think of the year. It's been quite a few years.
Yeah.
Quite a few years that you've had it. Was it at all intimidating to have it at first, to think, what if we actually do have to kind of take these life-saving measures, or was it kind of a relief to say we have this here in our building?
Change is hard sometimes, but it was a priority of safety. And when we had the opportunity to get these, we knew they worked to the point of after we received them. Since receiving, we've had 5 situations in which they've actually been used.
Wow. So in these cases, staff members who knew about it, I mean, is that kind of a reaction now? It's almost embedded if this happens?
Yes, our staff are trained. We want to make sure everybody went through the same trainings to understand it, not only the ADs, but CPR and first aid. And again, I was going to say those 5, as a result of the support from our staff, the quick response from the EMTs, and the emergency room services at Licking Memorial, all 3 survived. Wow. Or all 5 survived. I was thinking 3. I don't want to say
yes.
5 survived. Yeah.
All 5 of them.
Yeah.
Because of that, and so that kind of gives you peace of mind. And then your staff, Rob, when they receive these patients, how much of a benefit is that they were able to have this prior to coming in to the hospital?
No question. And it is so advantageous to allowing them to be helpful in the ED and up in the interventional cardiology lab when they've had the AED, the 12-lead EKG that we donated to all the squads. That information is made available, allows them to be even more successful in caring for the patients. Certainly want to congratulate Ed and the YMCA staff. They do such a tremendous job keeping folks healthy by allowing them to come and exercise. They just kicked off a project in Pataskala. Once again, we make these available because we want people to exercise and be healthy and not be concerned about if an event happens, is there going to be technology to help me out? And they do a great job getting folks in there exercising. We want to make sure they're safe while they do it.
All part of your commitment really to the community's well-being, along with members of the community like Ed. So I want to thank you guys both for having such a commitment. I mean, it says a lot for your community, and of course gives, I'm sure, all of your members a peace of mind. So
absolutely.
Thank you guys for being
here.
Ed.
Thank you.
Well, after the break, an incredible free program being offered by Licking Memorial is keeping hundreds of young athletes safe. You'll find out how you can take advantage of Heart to Play up next.
And later, I'll share 5 interesting facts about the community impact we provide. From celebrations to reunions, there's plenty of reasons to love your heart at Licking Memorial Health Systems.
Well, every parent wants to keep his or her child safe. And when it comes to parents of student athletes, it's not just sprains and strains that can cause anxiety. An undiscovered heart condition can lead young kids down a dangerous path. So Licking Memorial Health Systems is doing something about it. Rob, this is really cool. I want you to share with us about your Heart to Play program.
This is a program I take a lot of pride in. Dr. Diane LeMay, a pediatrician, and I worked on this early in my career as CEO. And there are a number of high school student athletes in that age range that die each year from sudden cardiac arrest or sudden cardiac incidents. And many of these can be detected with a simple, relatively inexpensive test, an EKG. And so we had done pre-participation sports physicals for many years, and we worked together on adding to that some additional heart screening with an EKG, and now even using an echocardiogram to try and make sure that that significant traumatic, tragic event doesn't happen in one of our communities, because we recognize it's traumatic tremendously to the family, but to the entire community throughout Licking County if we would lose a young student athlete and we could have detected it. It's well worth the money, the resources that we put into this program to protect these young student athletes.
And this is free to any student in Licking County, right?
Yes, we make it available to any student in Licking County, athletes. We even extend it to some of our technical students who are maybe in the firefighter program at our local CTEC that have high physical demands. We don't want any financial obstacles or barriers. We want to keep these students safe.
I want to share a story from a police chief, actually, of Granville, and his daughter who took part in this program. And you can kind of see that a lot of people hesitate because they don't want to find out, right, that something's wrong. But what a benefit when they do. So let's take a listen to them and hear how they got involved with this program.
My mom found out about the program, and she wanted me to be able to have the physical test so then I could do sports, and they were Catholic.
She had swam and had dizziness before and everything, and my attitude was toughen up. Wasn't aware that there was anything wrong.
So we had the test done, and the EKG was just something that was optional. After the EKG, they had it sent to some other doctors, and we actually found out something very interesting. We found out that I had WPW, which is Wolff-Parkinson-White. It can cause dizziness, lightheadedness. Might get confused because of those.
Dealing with the professionals here at LMH previously, I'd heard about this program, but I didn't give it much thought. Until it actually affects you, it really didn't strike me how important it was.
I get yearly checkups now to make sure everything's okay. If I ever have any symptoms again, I would tell my father and my mother, and then they would contact them. Yeah, the Heart to Play program I'm so thankful for that.
An important thing I've noticed is that since she's had the procedure, she hasn't had any of those symptoms where she was having headaches before, lightheaded. Now she works out and she's fine. She had the EKG because my wife insisted, and I'm glad she did, and I'm glad that Licking Memorial offers this Heart to Play program, because without those two things, we would have never known she had an issue. Again, my wife and I can't express our gratitude enough that this program is available, and available for all the students that are attending sports here.
And I think the important thing to note is that it was a good outcome, and it could have been very different had she not come in and had this testing done.
No question. I think you see on the video there, it comes full circle. She's participating in swimming at the YMCA, so it gets back to that collaboration. But you mentioned the hesitancy of the parents sometimes. You want to get your kids out there participating in the sports. You don't want them to fall behind if there's a bit of a delay in clearing them for an activity. But when you see what might come about and the importance of keeping your kids safe, it is certainly well worth it to have these tests done.
All right, if your child, of course, attends school in Licking County, contact the hospital, set up an appointment. Don't wait and don't have any excuses there, because it really is an incredible thing offered for free by Licking Memorial Health System. So, Rob, awesome to learn about that.
Thank you, absolutely.
Well, there is the national average, and then there's Licking Memorial Hospital. Up next, how it is exceeding the standards of heart care, and that's not all. All right, as we come to the end of the show, Rob and I are going to go over some brag-worthy moments about Licking Memorial Health Systems, because there are so many. And Rob, I know you are so extremely proud of your team, your staff, and it's really at every level.
No question. The brag-worthy nature of this segment is to the entire staff, the community, our board, that really support all the initiatives that we provide to our community. So it's certainly not about me. It's really about everybody at the organization, the entire community. Right,
that comes together to get there. So let's talk about first some impressive numbers. We just did a piece on the Heart to Play program and talked about how incredible that is. How many screenings have you done with that program?
We've done well over 10,000 sports physicals, but well over 6,000 heart exams. And we found 34 student athletes with significant heart abnormalities. Any one of them could have become, well, a catastrophic event.
Right.
And once again, the financial price for the testing, the human resources, well worth it to prevent just one of those.
And while we heard from one parent, I imagine the gratitude of all parents, especially when you do discover something, goes beyond, you're right, any price you could put on that.
No question. It's a great feeling for us as an organization. We hope not to discover anyone, but when we do and they can get it fixed and move ahead in a positive fashion, that's outstanding.
That's awesome. All right, you are also very active during Heart Month. We know it's coming up in February. What types of awareness events do you have planned this year?
Well, we have all kinds of awareness events, but I'll highlight just one in particular. Our Red Dress event highlights women's heart health, and it will be held out at Brindue Mansion again. Well over 300 attendees, and we'll focus on symptoms and signs and heart healthy activities specific to women.
All right, we talked earlier about the critical issue of time. There's an industry standard when it comes to treating patients with balloon angioplasty. We talked about with Dr. Rajoub. So what is that standard?
The standard is 90 minutes, and once again, our practitioners exceed that standard. We're well into the maybe mid-50s, and our ability to work with our squads, as you see here with this ambulance, we're able to get those results of the 12-lead EKG typically into our ED and into our practitioners' hands in just a few minutes, which is also well above the standard of 8 to 10 minutes.
And in just talking with you and your team when I was there at the hospital, I found it incredible that you guys talked about how when a call goes out and there's a patient that's coming into the hospital, there is no, doctor, you have to be there. Everybody just comes. It's such a team atmosphere, and it's such a, above everything else, we care about the health of this patient.
Yes, I think that's absolutely correct. We focused a lot on the cardiology department, but the emergency department does a tremendous job. The squads out in the community and their participation, really, it's a complete team effort.
It is. All right. For patients who have survived a heart attack as well or other heart ailments, they measure their lives in before and after a lot of ways. What are some of the ways that you helped kind of support and celebrate their survival?
Well, we continue to have them come in and do wellness activities. We have different areas where they can participate with their friends, work on the treadmill or the bicycle. But we also have a reunion each year, which is a lot of fun for our practitioners, Dr. Rajoub, the other physicians, to see these patients a year, 2, 3 years out, to see how well they're doing. We have them in and have some healthy food, have some speakers and some education, and then have an opportunity just to enjoy a meal with them.
And I think that's interesting too, because if they may lose contact with their doctor, maybe, not having to see them as often,
right.
Which is a good thing, but they want to then check in to
Absolutely.
see what they have done to change the lives of these people.
No question. It's a great event.
All right, Rob, finally, you are a sponsor of the American Heart Association's Heart Chase event. What is that about?
Well, the American Heart Association does a great job with this event. They educate communities. Licking County has really been a leader in this event, one of the top ones in the country, even against much larger cities. We'll be in downtown Newark in a few months, and a lot of fun activities, but mostly education, teaching people about the importance of things like CPR, first aid, heart health. It's a great event. We're happy to be the lead sponsor of that.
Yeah, absolutely. I mean, educating the community, being there for them, obviously what you do day in and day out. That is very obvious. So we appreciate that. As always, it has been such a pleasure having you, being able to highlight so much. I'm sure our viewers have learned a lot about their own heart health and how you guys care for your community.
Robin, it's great to work with you. I appreciate the opportunity to really highlight in more detail what we do at Licking Memorial. So thank you for having me.
All right, to learn more, which you will, of course, go to lmhealth.org. As always, be thankful for today, everyone. Have a great weekend. I'll see you Monday.